Welcome, everyone. We will be proceeding with the webinar now. I'm Len Rubenstein. I'm at the Center for Humanitarian Health and the Center for Public Health and Human Rights at Johns Hopkins Bloomberg School of Public Health, and I welcome all of you to this discussion. As we know, when Donald Trump came to the presidency with an anti-immigration agenda, part of it was to restrict refugee admissions dramatically. That was a departure in many respects because refugees had always been recognized as a special category of immigrants because they were fleeing persecution, and also that their rights were recognized in an international treaty. Notwithstanding, the administration dramatically reduced admissions of refugees down to 80% fewer than during the Obama administration. Last year, there were fewer than 20,000 people admitted as refugees. Apart from the question whether refugees are admitted at all, there's a question about how to set the number of refugees admitted each year. The decline in the numbers puts that in sharp focus. Is there a moral, ethical, or human rights basis for determining that number? How are policy considerations and practical ones figured into the determination of that number? In anticipation of a time where the refugee program was restored, and with support from the Johns Hopkins Berman Institute of Bioethics, a group came together, some of whom are represented on the panel today, to look at these questions. We looked at moral theories related to refugee admission, interviewed individuals involved in the process from refugee settlement organizations, think tanks, and elsewhere across the political spectrum, although we were unable to secure interviews with Trump administration officials. We will share our findings today, as well as perspective on them from two of the participants in the study, Rachel Fabi and Daniel Serwer, and getting the perspective as well of Eric Schwartz, who was one of the people we interviewed and has also served as Assistant Secretary for Population, Refugees, and Migration in the Obama administration. I also want to recognize three others who were involved in the study: Paul Spiegel, Govind Persad, and Namrita Singh. The first speaker will be Rachel Fabi, who is Assistant Professor at the Center for Bioethics and Humanities at SUNY Upstate Medical Center. She was lead author of the study, which is the subject of the discussion today, and we will put the citation of the paper in the chat for those who are interested. She has written extensively on ethics and justice issues in immigration, including public benefits. Next up will be Daniel Serwer, who is professor of the practice at the School of Advanced International Studies at Johns Hopkins. He served for many years in the State Department, including as minister counselor, directing the European Office of Intelligence and Research, and served as special envoy and coordinator for the Bosnian Federation. He also served as vice president of the U.S. Institute of Peace and is the author of numerous books, most recently, From War to Peace in the Balkans, the Middle East, and Ukraine. Finally, Eric Schwartz, who I mentioned was previously Assistant Secretary of State running the refugee program and now is president of Refugees International. He began his career on refugee issues at Human Rights Watch, served at the National Security Council in the Clinton administration, and later as a UN Deputy Special Envoy for tsunami recovery after the 2004 tsunami in Asia. So we will get right to it. After that, there'll be plenty of time for questions, we hope, and you can put your questions in the chat. So we'll start with Rachel.
Thanks, Len. I'm just going to share my screen so we can get some slides up. There we go. So as Len mentioned, I'm going to presenting the findings from the study that we did on determining the number of refugees to be resettled in the United States. And this is going to involve going through a little bit of background, but mostly I'll talk about the findings that we had from our interviews with various stakeholders. And then Daniel and Eric will be discussing sort of the meaning of those findings in the current administration. So as Lynn mentioned, this was a team project. Lots of effort went into it. And we were talking specifically about refugee admissions. So this is a figure from the UNHCR, UN High Commissioner for Refugees, showing that at the end of 2019, there are almost 80 million people who have been forcibly displaced worldwide, 26 million of whom are refugees. And that's who we are talking about today. So people who are outside their country of origin and have a fear of going back due to persecution. And you can see here the refugee ceiling since 1980, which is when the United States passed the Refugee Act. That ceiling has sort of hovered between 75 and 80,000 refugees admitted per year in a typical year, although there are some deviations from the end of the Cold War and also on 9/11, and then a very clear drop off during the Trump administration. The explanation given for this by Secretary Pompeo, he described the ceiling as a reflection of our commitment to, quote, protect the most vulnerable around the world while prioritizing the safety and well-being of the American people. And you can see on the right sort of how those numbers declined. So in 2016, again, we were in sort of that average between 70 and 85,000. President Obama had actually set the ceiling for 2017 to 110,000 before leaving office, but that was cut pretty much in half by the Trump administration when they came in. And you can see the decline down to 18,000 admitted last year. And actually, you can see from this chart, we didn't even hit the ceiling several years during the Trump administration. So although the ceiling was 18,000 last year, we didn't admit probably about half that. And so, as Len mentioned, our study began with a scoping review of the moral justifications for resettlement. Why do we have, or do we think we have, a moral obligation to do resettlement? And we identified 4 major sort of streams of moral theory that could justify such an obligation. The first being humanitarianism, which is a duty to rescue when costs are low. And this, there are a number of moral theories that could ground a humanitarian duty. It's also pretty intuitive if you think to, the biblical story of the Good Samaritan, or a thought experiment of walking around a lake and seeing a person drowning. Do you have an obligation to throw a life preserver if the only cost to you is to do so? And intuitively, the answer to that question is yes. Another moral theory, we have questions of fairness, so equitable distribution of the burden, right, burden in quotes, of distributing refugees between states. Also reparative duties, so this is a relational duty that's generated when one country is responsible potentially for the harm that led to forcible displacement. They may therefore have a duty to repair. And then finally, some theorists justify resettlement based on appeals to the legitimacy of the international state system. The idea being that we live in a global society where people are organized into countries, and that for people for whom their assignment to a country is disastrous, in order to maintain the legitimacy of the system we've set up, we have to make things better for those people. And so our goal in doing this project, we had several, but one was to sort of map what our respondents said onto these various moral theories for why we may have an obligation to do resettlement. And Joseph Cairns, who is an immigration theorist, wrote in his book, The Ethics of Immigration, that there is a deep conflict between what morality requires of democratic states with respect to the admission of refugees and what democratic states and their existing populations see as their interests. And so we're going to talk a little bit also about what those interests are, so the practical reasons for doing resettlement, to see if this conflict truly exists. And so the practical ethics questions that drove this project were, how many refugees should be admitted for resettlement, and how should that number be determined? As I mentioned, we did our literature review of the theory, which I just sort of sped through. And then we engaged key informants who had previous experience with the refugee resettlement process in some in-depth interviews. So we did 13 interviews with 16 people, a few of them were group interviews, and then engaged in a qualitative analysis of the findings using an iterative emergent thematic coding approach. And then we sort of, as I mentioned, mapped those findings onto the moral theories. So did a normative analysis of the findings through that lens. And so you can see here our participants. Some key informants fell into multiple categories, but we interviewed people from State Department leadership, former State Department leadership, I should say, resettlement organization leadership, advocacy group leadership, executive branch officials, think tanks, both liberal and conservative think tanks, UNHCR leadership, a staffer to someone on the Senate Foreign Relations Committee, and a House senior staffer. And so through these interviews, we arrived at three sort of overarching themes related to why we do resettlement, so and how to do it. So the first would be the policy goals of resettlement. These are practical reasons from either a domestic policy or a foreign policy perspective for why we resettle refugees. The second were the underlying values, these moral reasons for doing resettlement. And then finally, a lot of our respondents talked about barriers to or facilitators of resettlement. So what are the practical things that either make it harder or easier to bring refugees to the United States? So the policy goals, again, I mentioned they fell into two camps. We had foreign policy goals and domestic policy goals. And I'm going to walk through each of these briefly with a few quotes just to illustrate some of the things that our respondents said. So on the foreign policy goal side, I know this is a pretty busy text-heavy slide, so I've highlighted sort of the key points here. But the first foreign policy goal that our respondents talked a lot about was that our taking of refugees influenced other countries to take refugees as well. So if we increase what we're doing, it pushes other countries to increase what they're doing in terms of admitting refugees, and that this builds resilience into the system. Another sort of set of themes that this quote encompasses were host country stability. So taking refugees helps those countries that are currently hosting refugees either in camps or in their civilian populations. And that taking refugees is another way to stand by our allies and to signal solidarity with our allies. So this respondent talked about Jordan. At the time, Jordan probably had 1 in 11 people within the country's borders were refugees. And this respondent told us that taking more refugees from Jordan signaled our solidarity with them as an ally, but also helped to stabilize the country itself and sent political signals that we're standing with them. On the domestic side, the two major domestic policy reasons for admitting refugees, one was national security. So people that we spoke with said, and this was, again, as Len mentioned, around the time of the Muslim ban for refugees. One of our respondents mentioned that if we're sending a message that Muslims aren't welcome here, that signals to ISIS that we reject Muslims. So it's actually bad for our national security, despite the Trump administration's assertion that it was that it supported national security to limit refugee resettlement from Muslim countries. And then another domestic policy goal identified by our respondents was that taking refugees or refusing to take refugees was useful from a political messaging perspective. So setting up refugees as some kind of a threat for the Trump administration was politically useful. In terms of the moral values that our respondents endorsed as reasons why we should take refugees at higher numbers, the first was to protect the vulnerable. And this came up again and again. This was probably our most common theme, that the reason we should accept refugees is because of these principles of vulnerability. And one of our respondents argued that we have an obligation to the person 10,000 miles away from us, no different than the obligation to the person right next to us. And if you think back to the moral theories I presented earlier, this is a clear appeal to like a humanitarian and a human rights perspective, that all humans are of equal moral worth. And so those who are vulnerable deserve our help. Another set of values that came out of these interviews again, reciprocity and fairness. So for our partners where we've mucked up situations like Iraq and Vietnam and Afghanistan, we may have a moral obligation to accept more refugees from those countries because we're responsible for displacement, and that this is also reflective of fairness. Other values, one value that was endorsed by quite a few of our respondents was diversity, and the idea that we should accept more refugees because diversity is in itself a good thing. So we're an immigrant country, and I think there's tremendous value in extending our hand. I think we end up enriching our society as a consequence in really significant ways when we take more refugees who can increase the diversity of our nation. And then again, this was in the foreign policy goals section, but it's also a moral value, this idea of solidarity. So that taking refugees signals solidarity to our allies and to other countries, and says we're with you in the struggle. And then in terms of the potential barriers and facilitators of resettlement, so these are like the practical issues that would affect how many refugees we can take. The one that came up again and again was processing capacity. So the capacity of the government agencies to run the program, particularly DHS, that's a political decision. So the idea being there has to be political will to increase capacity. Do you give DHS the resources they need to vet the number of people that have been agreed to? And this respondent said the Obama administration did, and the Trump administration does not. And also in terms of capacity, just to define that a little bit better, you talk about capacity on both ends, overseas and domestically. And this respondent tied that capacity to the budget and said it's very expensive to resettle refugees. So you have to decide, is this money best spent resettling a marginal number of refugees, or is it better spent helping more refugees overseas? And so this was an argument slightly outside the scope of what we were talking about, which was what should the cap be? But an argument that rather than talking about what the cap should be, we should be talking about what our obligations are to refugees outside of, our borders. And then one more thing on capacity. Our respondents, a few of them mentioned that because the ceiling had been lowered so dramatically, agencies were closing or would be closing. And so there would be a significant loss of infrastructure and expertise, which would affect capacity even now following the Trump administration. As we try to raise that ceiling back up, there's been some loss of expertise and infrastructure that might keep that number down. And another practical feature or factor rather in how many refugees we can admit are community factors. So some of our respondents talked about the process of working with mayors and local governments and doing consultation with the community to make sure that there's political will and community support to admit refugees, as well as sort of supportive things in place like affordable housing that would be necessary for a locality to admit more refugees. So returning to those moral justifications briefly, you could see we called out a little bit where humanitarianism was appealed to, the idea that if people are vulnerable, we should help them. Also quite a bit of discussion about the equitable distribution of, again, burden in quotes between states and these reparative duties, especially in places where we had mucked stuff up. And then these legitimacy claims as well, especially talking about stabilizing host countries. In order to maintain an international state system, you need to have stable states. And so all four of these mapped pretty closely onto our findings from our discussions with the people that we interviewed. So returning to Karen's, he said the gap between what morality requires and what serves even long-run self-interest is so great that interest can do very little work in supporting morality. And I think that from our discussion, we found that this isn't necessarily true, that there's actually a lot of reasons why admitting refugees is in our long-run self-interest. And so actually the gap isn't necessarily between morality and self-interest, but between self-interest and what we perceive to be our self-interest. And so we follow Matthew Gibney in our paper to argue that this conception of costs and burdens, which I've put in quotes, at the heart of this humanitarian obligation is a social and political construct. And so there are two duties that sort of follow from this to close that gap between self-interest and morality, that we have an obligation to reshape the political space to make it more conducive to the reception of refugees and asylum seekers. So we should be, working on public messaging and reframing the discussion around refugees to make the public recognize that actually our self-interests are potentially more aligned than the common perception may indicate. And then also that we have an obligation to create a domestic and international environment in which the amount of protection provided for refugees at low cost will be maximized. And so we concluded our paper with recommendations for what the number should be set to. This paper came out a year ago, and the work on it was done before that. But our conclusion at the time was that the US is duly obligated to admit as many refugees as processing capacity and community factors allow, and to actively seek to increase political will to support the resettlement program in order to raise that ceiling. And so in practical terms, what we recommended was to reset the ceiling to 75,000 to 80,000 with room to increase according to global need, which, as I showed, is quite high. And we also recommended that any dramatic departures from the ceiling be approved by Congress, because another finding from our discussion, and also something that had been reported in the news, was that traditional processes for setting the ceiling were not necessarily followed by the Trump administration. There should be congressional consultation that did not appear to have happened. And so I'm going to turn it over, stop sharing my screen, turn it over to Daniel for the next phase.
Thank you very much, Rachel, for that wonderful presentation of this work. I should tell you all that I'm the one who collected the data on which the assessment was based, or largely based. It's one of the few times in my mostly internationally focused career that I've exploited my diplomatic skills to hear American views, and it was extremely stimulating, as I hope I'll illustrate in a moment. The people I interviewed were all familiar with the resettlement issue as government officials, as think tankers following the issues, as NGO or international officials with relevant responsibilities. The range of political views was really quite wide, and it did include people working in the Trump administration, but not Stephen Miller or others in his inner circle who were the people setting policy on this and many other immigration issues. They either didn't answer multiple requests for interviews or bluntly refused to talk with me. I did, however, talk with people inside government as well as outside, generally sympathetic with the administration's views on immigration and resettlement. Ethical issues were not foremost in the minds of most of the interviewees, but on questioning, all agreed on the moral imperative of helping resettle at least some refugees. That consensus was strongest with respect to Afghans, Iraqis, and others whose lives were in danger due to assistance they'd afforded Americans during wartime. There was no dissent from the duty to repair in those circumstances. There was also general agreement on thinking about refugee resettlement as a human rights and humanitarian issue, albeit one that had to be limited by practical and financial considerations. But within that scope of things, everybody agreed on the need to give priority to the most needy and on non-discrimination, in particular based on religion. This was after the Trump administration had prohibited visas for people from some Muslim countries. So I think it's significant that there was agreement on non-discrimination on the basis of religion. There was less agreement on the broad humanitarian imperative, partly because in its boldest form, it rejects practical and financial considerations. Some also thought keeping people close to their original homes, as Rachel has mentioned, was more likely to enable returns which they regarded as preferable in principle to resettlement and certainly far less costly, enabling more people to be assisted. Personally, I think that trade-off is a serious issue, resettlement versus aid in place, because of the cost considerations. There was also less agreement on the contribution refugee resettlement makes to foreign policy and the legitimacy of the state system. Some insisted on this point as unhesitatingly. They were mostly on the left side of the political spectrum. Those closer to the Trump administration rejected it as an exaggeration, but mainly I think because they were unconcerned with what others term the rules-based order. They either don't think it exists or that it isn't worth maintaining. There was considerable concern across the spectrum about implementation issues, including possible fraud or other malfeasance in the selection process, the capacity of the US government and non-governmental organizations to handle refugee resettlement, especially when the Obama administration bumped up the numbers in its final year, and admission of people whose attitudes on gender and other issues might make their adaptation to American mores and law. Some issues commonly discussed in the public sphere at the time were not important in discussions with these experts on the left or the right. None thought there was more than a proportional and therefore very small security risk from resettled refugees. Most thought they represented a far lesser threat than immigrants of other sorts and native-born Americans. My overall conclusion is that there is more room for consensus across the political spectrum on resettlement than on immigration more broadly. So long as due diligence is faithfully conducted and the numbers can be capably handled by resettlement agencies and welcomed by local communities, few of the interviewees saw a big problem with the numbers, so long as they did not go up or down precipitously and thereby strain the system for handling. The limits were more practical than ethical, even if all agreed that there's an ethical imperative. But reaching and maintaining this consensus across the political spectrum, and I'll be interested to hear from Eric whether he thinks I'm being realistic, would likely depend on keeping the issue of refugee resettlement separate from the general issue of immigration, especially at the southern border. I'm not sure that can be done or that everyone would want to keep the two issues separate. But doing so would, in my view, be best from the point of view of refugee resettlement. Let me stop there.
Thanks, Daniel. So why don't we turn it over to Eric now? You're muted, Eric.
I find that I'm usually most articulate when I am muted, but we'll give this a shot as well. Thanks, Len, and thanks to Johns Hopkins for this really interesting and important work. Before I start, I think I would just modify what Dan said slightly. I think the distinction is not so much refugee resettlement and immigration, but possibly refugee resettlement and asylum at the border. I think that's, that may be the distinction that is worth discussing. When I served as Assistant Secretary of State, for me, the critical issue was not so much the number of refugees who would be resettled, but rather ensuring that those who are resettled were resettled with more than a modicum of dignity. When I was appointed, we were on the heels of the Great Recession of 2007 to 2009, at a time when the reception and placement grant provided by the Department of State to incoming refugees had declined significantly in real terms over the prior decades, and resettled refugees, not to mention the agencies that were involved in resettling them, were suffering. To be sure, the US refugee resettlement program is modeled on the principle of self-sufficiency. And on balance, I think that is probably a good model, but it requires some degree of federal and state support, which at the time of my appointment was at about $900 per refugee. So we doubled that amount and made it inflation adjusted in, I think, about 2010. But we didn't make much progress during my tenure. If you define progress in terms of moving beyond the numbers, we were probably at about 75,000 or so, give or take 5,000 when I was serving as Assistant Secretary of State. So now to get to the subject of the discussion, in terms of an appropriate number for US resettlement, I guess I come to the issue in a pretty simple and straightforward way. I take seriously the UNHCR's estimate that of the world's refugees who are in temporary refuge, maybe there are about 1.4 million or so in need of permanent resettlement, whose circumstances are such that they have particular needs that would be most appropriately resolved through resettlement or third country resettlement. The terms are used synonymously. Third country meaning, of course, a refugee is in refuge in a second country and can be resettled to a third country. A ballpark, 1.4 million is probably about 5% of the world's refugees. And it seems to me the UNHCR number of 1.4 million or thereabouts tends to confirm an understanding to which Dan alluded, that for most of the world's refugees, third country resettlement might not be the most viable or even necessary option. But for a considerable small minority of the world's refugees, and far greater than the numbers who are resettled each year, third country resettlement is an appropriate option and an important option. So if you start with that number, and we can debate whether you want to start with that number, but if you do, and if you look at factors like the US share of world gross domestic product, the US relative level of wealth, our history, troubled though it may be, our history of immigration and refugee inclusion, why wouldn't we be prepared, and why shouldn't we be prepared to resettle about a quarter to a third of this total, perhaps over a couple of few years, and use that willingness as a means to promote commitments from other resettlement governments around the world. After an international responsibility sharing effort made progress on resettling those in urgent need of resettlement, the United States could then make annual assessments based on ongoing needs, which might in fact be well lower than a 1.4 million total, which we can presume is a total that has built up over some period of years. In the current COVID environment, we are, of course, very far from anything like those objectives. With, I believe, less than 25,000 resettled with UNHCR assistance globally last year. But even back in the pre-Trump era, say 2016, statistics for all resettlement, and I believe that includes both UNHCR assisted and non-UNHCR assisted, I believe stood at about 190,000, still far below the numbers of those deemed by UNHCR to be in need of resettlement. So, so there's much work to do. In terms of the criteria, I do believe that all of the factors described in the article and in the presentations about which I discussed with investigators as I was an interviewee. I heard some of my comments repeated by some of the presenters. I believe all of those factors are reasonable ones. A humanitarian obligation, responsibility sharing in sustaining an international political system, human rights obligations, and in particular, the norm of non-discrimination, and repair, that is meeting what may be a special obligation to those from societies in which your government, our government, has been engaged, often to the detriment of those who are seeking to flee. I would also argue that refugee resettlement can serve short-term policy goals, enrich the very fabric of our society. I'm not sure those should be the primary factors that at least humanitarians in government who are responsible for this program, I'm not sure those are the primary factors that would be considered in making decisions on numbers of refugees, unless you are in exceptional circumstances. But I don't recall that during my service at the Department of State, we had discussions. I do not recall discussions at senior political levels of these very basic issues of principle. They're sort of in the bloodstream of the institution, but I don't recall high-level political discussions of these issues. To be sure, no one factor can predominate on this issue, as circumstances vary so widely. We do have an obligation to resettle Iraqis and Afghans due to our presence in those countries. We are also obliged, I believe, to pursue refugee resettlement from Central America due to our proximity to the Northern Triangle, to the suffering that is taking place there. Our norms of non-discrimination require, again, in my view, that there is a diversity of religions, ethnicities in the US refugee resettlement population. And no particular formula for allocation will suffice. But I certainly believe that more explicit discussion at high political levels in the United States, within the international community, can only be helpful and generate, and also generate support for generous resettlement programs. Indeed, the high percentage among resettled populations in recent years of those who were originally from places like Syria, the Democratic Republic of Congo, Iraq, Somalia, certainly suggests that the kinds of factors described in the article do, as a practical matter, play an important role. But a more systematic, a more comprehensive, a more articulated deliberation and expression of those priorities at the national and at the international level could only move this process forward.
Thank you very much. And I thank all of you for both incisive presentations and also sticking to the time schedule that we planned. We have a lot of time for questions, so I invite people participating or in this to put your questions in the chat. But I would like to start with a few and kind of picking up on what Eric kind of finished with, which was about the need for high-level political discussions. And this is not just a question for Eric, it should be for all of you. One thing that hasn't come up in the discussion is the role of Congress. Under the law, Congress is supposed to play some role in determining the number of refugees, but by and large has deferred to whatever administration is in power decides. Should that be changed? Should there be a much more active role for Congress in this process? Whoever wants to speak. Maybe we'll start with Eric because you've been there.
I will refrain from speaking until you call on me because I will have answers to all of your questions.
All right.
The answer is I don't believe that Congress should, by law, be playing necessarily a more significant role in the consultation process. But I think as a practical matter, Congress should be playing a more significant role in the consultation process. What does that mean? It means that consultation has really degenerated in large measure to informing rather than consulting. And so I think there's no real downside in my view to strengthening the consultation process and creating more stakeholders on Capitol Hill. So, but I think there's a more fundamental point on this issue that I want to mention because I'm afraid we're not going to get to it. And that is that between 1980 and about 2015, there was a broad bipartisan consensus in the Congress on the importance and the value of refugee resettlement. I don't think Congress would have batted an eye if an administration decided they were going to do 90,000, 100,000, 150,000, maybe 150,000. It was the George W. Bush administration that implemented a significant and substantial resettlement program for Iraqis. I believe in his last year in office, I believe they resettled about 14,000 Iraqis. That consensus broke down in 2015, and tragically, the issue has become highly partisan and politicized, and that that is terribly unfortunate because getting that consensus back is going to be a real challenge, especially in this nutty political environment nationally that we find ourselves.
And maybe I can add a word here.
Sure.
Our colleagues at the Heritage Foundation have published a suggestion that if the percentage is either increased or decreased above a certain level, I think it's something like 30%, that then Congress should be more thoroughly consulted. And I think there's some virtue in that idea. Of course, it happens automatically in a way because it all depends on appropriations, and Eric knows better than I do how important that is to the process. But I do think that avoiding easy executive action to sharply increase or decrease the numbers would be consistent with kind of the consensus that I perceived across the political spectrum.
Thanks.
Yeah, if I could just add briefly, I think part of your question hinges on what we mean by consultation too, right? It doesn't mean that they have some sort of veto power. It doesn't mean that that Congress just gives advice that the Domestic Policy Council is then free to ignore. So I think having a clearer sense of what that consultation process looks like is key to answering your question. But I agree with Eric that if in a world where refugee resettlement is politicized, it seems to me like a good thing to have a check on a leader of the Domestic Policy Council who told, or someone familiar with his thoughts told us that he felt the correct number of refugees to be admitted was, quote, between 0 and 1, unquote. And so I think having some sort of protection in place to keep that from happening, it can't be a bad thing, but there needs to be maybe a little bit more clarity around what we mean by consultation.
I want to stick with you for a minute, Rachel, and it is a question that the other speakers can also address. Eric raised the foreign policy issues, and in the analysis, of course, the burden sharing issue came up. Should there be some kind of international process where countries get together and try to allocate burdens? And we know, for example, that some European countries take huge numbers of asylum seekers. Should that count? How should there be an international process on burden sharing?
I mean, this actually may be a better question for the other two. From, like a moral stance, I think that it would be great if there were such a process, but practically speaking, I think Daniel and Eric can probably say more about whether that's a practicable option.
Eric, you've been there and done it. My understanding is that there is an informal consultative process.
I mean, I think the short answer to the question is not obviously, but for some of us, it's obviously yes. And so the real question, not the real question, but the next question is, what's out there? And I think the most significant effort in recent years in promoting the idea of international burden sharing was probably the Refugee Summit of 2016, which the Obama administration really drove. Other governments were involved, and it was sort of twinned with the UN's summit on migration, and that resulted in a couple of international instruments. But the point is that effort, what accompanied that effort, was a significant diplomatic initiative by the Obama administration to get other governments to sign up to commit to additional resettlement. And if you Google the Refugee Summit of 2016 and you find White House statements, you will read about the commitments that the Obama administration was able to secure in partnership with other governments. That's so on one level, there needs to have greater international burden sharing, but it's got to be driven by strong and powerful states or a state that cares about these issues. The UNHCR does have, they present to governments, they certainly don't present to the governments 1.4 million refugees for resettlement, but they do present to governments many tens of thousands of refugees every year for consideration of resettlement. And traditionally, a significant percentage of those candidates are resettled in one way, shape, manner, or form, or have been traditionally. The Trump administration and COVID-19 has changed a lot of things, and so we'll see how how that process and procedure continues.
Thank you. We have a couple of people who want to ask questions, and first is Court Robinson, and then we'll unmute. He is unmuted, and then Tara will unmute you if we need to. Court, go ahead.
Thank you. Appreciate the presentation and looking forward to reading the paper. I was chatting sidebar with Eric Schwartz as we were talking. He and I met back in the 80s. He was with Asia Watch. I was with a group called Indochina Refugee Action Center, and then U.S. Committee for Refugees. And we were pushing refugee resettlement of Southeast Asian refugees. And picking up on the theme, I think Andrew Shaknov said asylum and including refugee resettlement is only one part altruism and at least one part self-interest. Maybe self-interest rightly understood, but certainly self-interest. And we were resettling Indochinese because we had a moral obligation to do it because of our involvement in the war, but also we were buying open shores. Open shore for an open door was the formula. If you resettled refugees, then Thailand and Malaysia and Indonesia would not push boats back. And so lives were being saved by being open to resettlement. We were taking 1.15 thousand a month. And there was bipartisan support for that. So Ted Kennedy and Jesse Helms and Orrin Hatch and Alan Simpson, and they disagreed on many things, but often would come together and support large numbers of refugees. And my concern is that this bipartisanship isn't just a matter of sort of the toxicity or loss of bipartisanship. It's not just a matter of the toxicity of the last few years. I think it's really very deep within our system now. We have a party that is really fundamentally anti-immigrant. And I don't know how we'll get that back. It is political, it's always been political, but it's been bipartisan politics that's kept it alive and thriving for many, many decades. And I would just be interested to hear the panelists' comments. I'm looking for signs of hope, but I see this loss of bipartisanship really fundamentally, existentially threatening our commitments. We may pull some things back in the next 2 years, but wait till 2022 when Congress may change hands. I'm very worried that we will not be in lead on this because we cannot get bipartisan consensus on some of these core obligations. Thank you.
Well, there's the most challenging question. What's our sources of hope? Who wants to begin?
Well, this is the reason why I said that at the end that separating the issue of resettlement from the general issue of immigration, or if, as Eric says, the issue of asylum at the southern border. I think the best hope for bipartisan support for resettlement is if you separate those issues and keep them separate. Is it possible to separate those issues? No, not for the most extreme anti-immigrant people in the country or in the Congress. But I think there's a piece of the right wing that can accept substantial numbers for resettlement, so long as it's about resettlement and not about the southern border.
I personally take issue with that separate. Daniel, you said that it would be beneficial if we could separate it and that it would be challenging for extreme anti-immigrant folks. I think that would be challenging also for people who are extremely pro-immigrant to separate that out and create a hierarchy of who is deserving of our help and who is not. I think on the left, you're going to get just as much pushback on that kind of distinction as you would get on the right, in my view. And I think there's, we should give some thought to the framing of this discussion around people as burdens as well. I had that in quotes in the presentation because that was what people had said, right? But I find that framing also problematic.
I don't disagree that there will be that reaction on the left, Rachel. I'm just saying the best hope for bipartisanship, if you want it, is to separate the issues.
Maybe Eric can resolve this.
Yeah, well, I don't know about that, but I do need to note that, Court's reference to the late 1980s, I was a middle school intern at the time. So in terms of, so I think I was about 11 or 12 back in 1988. Obviously, I'm joking. I'm not going to dwell on that issue, the issue of, refugees who show up at the border versus refugees who are resettled, because it could take us another hour to discuss. But I will note that anti-immigrant forces are going to push back against any separation of those issues. But those issues do have a natural separation. They're different sets of issues. And so the discussion within the advocacy community is, when we do messaging about welcoming new Americans, do you make a distinction between the refugee resettlement program and asylum or not? My own personal view is, I don't think it makes a difference. I don't think most Americans make a distinction. And so I think that messaging should be that messaging. And when you advocate for the refugee resettlement program, you explain what the program is. And then those who are opposed to immigration generally will try to connect it to the most hot button asylum issues. And it is the dilemma that we experience. But I want to make a point on the original question that was asked. There are a couple of things at play here. In the 70s and 80s, our refugee program was very much influenced by the Cold War. And so we had huge numbers of Indo-Chinese who were resettled and Soviet Jews who were resettled. But the period between, say, the mid 80s, early 90s through 2015 demonstrated that we don't need that kind of political, Cold War rationale to have a healthy resettlement program. Because for those 25 years, we did have a healthy resettlement program. Maybe we didn't get to 200,000 a year, but we were able to, push to, very significant numbers, in some cases approaching 100,000.
At the source of hope, we have one more question we want to get to. So could
Sure.
you wrap this one up, Eric?
Sure. I just did. That's fine.
Okay.
I made my fundamental point.
Okay, the last question goes to Tara Dungana. You're on.
Thank you. Thank you for letting me speak here. I'm a former refugee from a country called Bhutan, and proud of the proudest citizen right now of this country, because there is no other country I can call home. Want to make a point about burden sharing that was in discussion earlier. What does that do to the families? In my context, when the resettlement option came available for the families, for us in the refugee camp, refugee did not have voice about where they can go. Okay, so there were 8 different countries who wanted to resettle Bhutanese Nepali refugees from Nepali refugee camps in Nepal. So I think the idea behind all these 8 countries coming front was burden sharing, right? They want to share this burden of Bhutanese Nepali refugees in the refugee camp who have already spent over 20 years in the refugee camp by then. So what did that do is I have some families who are resettled in Canada. I have some families who are resettled in New Zealand. I have some families who are resettled in Australia. So the resettlement option, yes, it's a good thing. It's a humanitarian. Everybody has to take it, but it broke up the families. Now I have a family who wants to come to US, was originally resettled in New Zealand because I didn't have that choice, like where can I go? Which country can I go through the resettlement process? So the point I want to make here is like, I hope that's into consideration or in the thought process of the resettlement.
Thank you. Thank you. We'll need some quick answers because we're running out of time. Anybody want to take that?
Yeah, I can speak very briefly. First of all, there are some academics and advocates who are pushing for a very rights-based approach, which would promote the maximum amount of human mobility for refugees and others that would address the concern you've described. But that's pretty that I wouldn't call it a pipe dream, but that's very aspirational given the current nation state system that we have. So short of that, governments and international organizations, I think, have responsibilities to promote, among a range of issues in refugees resettlement, to promote the principle of family unification. There are decisions that can be made by governments, by UNHCR, in terms of where they make recommendations, and governments can do the same thing. And to the extent that they don't, they should. So the problem you've described will be less of a problem rather than more of a problem.
Thank you. We're just about out of time, but I want to give each speaker about 30 seconds if you want to make closing remarks. So whoever would like to say anything to close, you're welcome to. Or if not, just say so.
I'll just say thank you.
Yeah, thanks. Thank you for the opportunity to talk about this work. And I can put my email into the chat if people want to ask follow-up questions about the paper or about the work that we did. I'm happy to provide that.
I concur in the thank yous.
Well, I want to thank all of you all the panelists and also all the people who've joined. And this is going to be a continuing issue. And I think we have to end that it's our job to build a basis for hope in this program. That's our task. So thank you very much, and have a good day. And the recording will be posted at the site of the Center for Humanitarian Health. Have a good day.